For better or worse, I get the McDreamy thing a lot.
Move over, McDreamy.
I've never seen the man in action. In fact, I've never seen a full Grey's Anatomy episode. But you asked for it, so you got it.
A month ago, you were in med school being taught by doctors. Today, you are the doctors.
First of all, I've never heard a speech given that dramatically on an intern's first day. Nobody really talks like that. It's much more practical.
5 of you will crack under the pressure. 2 of you will be asked to leave. This is your starting line. This is your arena.
This sounds like Hunger Games more than it does Grey's Anatomy.
No, I'm not gay. It's just that, you know, you were very unforgettable.
O'Malley, Yang, Gray, Steven.
We do get ready together in the mornings. There are locker rooms like this. It's funny to say, but because doctors spend a lot of time in books while in medical school, they're not the greatest at interacting with others or maybe even showing interest in the opposite sex. So I've seen situations like this happen a lot, where someone's trying to make conversation, but they're not great at it, so it comes off very awkward. It's funny, but this is very accurate.
Your first shift starts now and lasts 48 hours. Your interns, grunts, nobodies, bottom of the surgical food chain.
Residents don't work 48-hour calls anymore. They're capped at 80 hours per week. Maybe they go a little bit over that sometimes, but 48 hours is just non-existent. And this started because of the Libby Zion law, which is sadly the name of a young girl who died because residents who were so overworked, they missed catching a diagnosis and she ultimately died.
Run labs, write orders, work every second night until you drop, and don't complain. On call rooms, attending call them, when you can wait.
The on-call rooms look exactly like this. They're very plain, they're very basic. The hospital doesn't budget or allocate any money towards them. You have to change your own sheets. The mattresses are basically plastic, uncomfortable. So this is very accurate.
Dr. Bailey, that's shotgunner.
That means every test in the book, CT, CBC, Chem 7, tox screen.
I love how simply the attending came in and made that decision. He basically saw maybe the chart, maybe a brief explanation of what happened, why the patient came in, and he already has a shotgun approach to this. This is not how medicine works. That's ineffective. You need to have a presumed diagnosis in place so that the labs and tests you order actually confirm a diagnosis. You can't just throw stuff against the wall, shotgun against the wall, whatever he said, and hope something sticks. The only time that is appropriate is if you have no idea why a young, otherwise healthy patient with an unknown history comes in with some sort of weird presentation. Then you can start ordering a broad range of tests. But they knew she had a seizure history, so why are they doing a CT scan? I need more info. More info, please.
Hello? You're so lost. What are you, like, new?
This is where these medical dramas get me. They make it seem like the doctors do everything from A to Z. They diagnose the patient, they run the tests on the patient, they draw the blood, they transport the patient. We have nurses, we have MAs, we have transport staff, we have PT therapists, we have respiratory therapists. I understand that they're trying to build up character, so they're trying to show as much of them as possible.
I'm just gonna insert my fingers into your rectum.
Why fingers? Just one finger.
Bet you missed a lot when you first started out.
No one was ever that mean. People wanted you to learn, they wanted you to get better. If you go into every procedure or every moment within residency with the concept that you want to learn and you want to do better, people respect that. So I don't necessarily get this hatred that these poor interns are getting. Our cafeterias are bare bones, with usually not the greatest food available. In fact, this is what surprises me most about hospitals. We try and tell people to eat healthy and stay healthy, but the only options to eat are pizza, burgers, chicken fingers, the most unhealthy foods possible. It's crazy to me.
You know what? I'm not the doctor. I'm a doctor, but I'm not Katie's doctor, so I'll go get him for you.
Very common situation to find yourself in, especially on nights when you're covering for the entire hospital and some medical emergency happens. The family wants answers. They have a lot of very important questions that they need answered, but you don't know the patient. You need to put a lot of information together rather quickly and create a thought process that the family can follow along with you so they know what's going on. You don't have to give a direct answer. A lot of residents, young residents especially, think that if they don't have the exact right, truthful answer, they're bad. That's not true. Even seasoned attendings know that there's times to say, we don't know yet what's going on.
Dr. Shepard, he's over there.
Why did I know this McDreamy guy is gonna pop into scene? Oh wait, did they not know each other?
Dr. Shepard, this is inappropriate. Has that ever occurred to you?
I agree with her. In a position of power, you should not be involved in these types of situations. They don't happen that often. As much as we like to believe that there's so much love and drama going on in hospitals, it doesn't happen as much as you think it does. But I have a little she may come back for more with the wonderful Dr. Shepard.
Let's move.
Usually we wear eye protection because if blood squirts out into your eye, that's pretty dangerous. So at least have goggles or the face shield that comes attached to the mask.
Appendix is out.
Not bad.
That was rather quick. I guess that's for TV's sake. In reality, there's a lot of conversation that occurs between the attending and the intern, especially with identifying landmarks. They'll often ask you really hard questions, and we call that pimping. And they'll ask you questions that are unrelated to the case, so you prepared for this case, but they'll ask you something else. It's very common.
Bucky, give him a clap.
BP's dropping.
He's choking.
Come on, George.
Today, pull your balls out of your back pocket. Let's go.
Who talks like that? Pull your balls out of your back pocket.
007 is a state of mind.
Well, it says the girl who finished first in her class at Stanford.
We lived with the vending machines. I used to eat Snickers galore when I forgot to bring my healthy alternatives from home.
Mr. Jones has chunky veins and he really needs antibiotics. I should start a central line.
So start one. You don't know how.
Clearly I'm very passionate about this. Starting a central line just because you couldn't get a vein with a needle prick is crazy. It's crazy. You're putting the patient at risk.
Dr. Bailey, I don't mean to bother you, but
Then don't.
it's Mr. Jones.
Is he dying?
No.
Then stop talking to me.
She should have gone to a nurse because nurses have way more experience than even doctors in getting a blood draw.
Next time you wake me, you better be so close to dead.
And that patient doesn't look alive for some reason. Oh, no, he blinked. Okay, he's alive.
Are you sure that's the right diagnosis?
Well, I don't know. I'm only an intern. Here's an idea. Why don't you go spend 4 years in med school and then let me know if it's the right diagnosis?
Ooh, that's what we call a cowboy intern. Basically, a cowboy intern is someone who is so confident in their diagnosis that they start their treatment, they don't explore any other options, they don't have a good differential, meaning other options of what the illness could be. Nurses keep the hospital running. Without them, we would not be able to do our jobs. A lot of times they'll catch our mistakes, they'll be able to identify things we could be doing better. This is the most drama I've ever seen happen in the first 24 hours of being an intern.
The Razapamp's not working.
Phenobarbital, load her with phenobarbital.
Okay, when you say load her with phenobarbital, that's not an order. You need to give the dosage. The nurse needs to say back to you to make sure that she heard the same thing that you said. Otherwise, if the nurse misheard you and you didn't even give the instruction of how much to give, they can give any dose, and that could be lethal to a patient, so that's not real.
Heart stop.
Okay, so heart stopping, that's the code blue. I've talked about this before. Now the patient is dead. If the heart has stopped, the patient is technically dead, and you have to work to revive them to get their heart started back up again. As the resident in charge, you have to instantly give roles to everybody. You do chest compressions, you do this, you give the medications, you monitor the rhythm strip. The most important role being chest compressions. You have to do chest compressions. You cannot stop doing chest compressions. So if you have one person that's giving bad chest compressions because they're tired, you instantly have to swap them out because chest compressions is what extends and saves lives. So right now, them not doing chest compressions is awful. The first thing you do is chest compressions.
Wait. Charge pulse.
Whoa. I hope she's not gonna shock the patient. Oh my God, please tell me she's not gonna. No.
Clear.
No, what are you doing, Grey's Anatomy? No.
Still VFib, nothing.
No. Oh, she's in
19
VFib?
seconds. Charge
Then why does it
300.
sound like she's flatlining? I've never thrown up in a hospital. I've never seen a doctor throw up in the hospital unless they were sick. Yeah, when things go wrong, you get nauseous. That's part of life. I mean, there's difficult moments that happen. There's times where you're gonna be humbled. I mean, every day I walked into the hospital as a resident, I was humbled. There's a reason why we call it practicing medicine, because we're all practicing, we're all learning, we're all adapting, we're all trying to get better. And the human body is a crazy, crazy thing that we still don't have perfect knowledge of. So I feel for her a little bit, you know, just a little bit. A little dramatic, but I feel for her. There's our man.
A seizure disorder. Now you're saying it isn't?
I'm saying that I don't know.
What do you
Oh, my man McDreamy saying my line. Real doctors are comfortable saying, I don't know. Because in reality, there's a lot we don't know. And when cases get very complex, like this young girl who's otherwise healthy is having seizures and then her heart's stopping, it's a very unusual case. Very, very unusual.
I want someone else. A doctor who knows what they're doing. You get me someone else. Someone better than you.
These types of conversations do happen. This is real life. People get very, very upset. It takes a lot of patience to deal with these issues. I've seen doctors get mad and snap. What I do is if I feel like I'm getting angry as well, I step away from the situation, let both parties cool down, and then come back and explain calmly what we're working on. Because if you just say we don't know with no follow-up, it seems like you're not doing anything. But if you say we don't know, but here's what we think it might be and here's what we're working towards, that's a much better answer.
He'll be fine, right?
Tony's gonna sail through. You have nothing to worry about. Promise.
Patients need reassurance. You need to give honest reassurance without over-promising them results.
What are you doing?
I'm suturing a banana with the vain hope that it wakes up my brain.
Suturing bananas, suturing pig's feet is something very common that med students and interns do. So it is true.
She's gonna die if I don't make a diagnosis, which is where you come in. I can't do it alone. I need your extra minds, extra eyes.
This is very dramatic. Every day we have meetings known as rounds where we sit around a table like this, we present a complicated patient, we give the history, we give the physical, we give the test results, and we all brainstorm ideas of what it could be, how we would approach the case, and it's very good practice even if we already know the outcome, but sometimes we don't know the outcome and we are brainstorming like you said here, but it's not this dramatic.
You can't comment, make a face, or react in any way. We had sex.
Bum, bum, bum.
Katie competes in beauty pageants.
I know that, but we have to save her life anyway.
Okay, she has no headaches, no neck pain, her CT is clean. There's no medical proof of an aneurysm.
First of all, this is known as a HIPAA violation. They're basically talking about a patient's case using her name in front of other people who are not involved in her case, and that is strictly against the law. They could get sued for millions of dollars, and rightfully so, because you shouldn't be discussing patient information in elevators. In fact, in most hospitals, you'll see a sign in the elevator that says, please don't discuss patient information.
Wow, that was quick.
His heart had too much damage to get him off a bypass. I had to let him go. It happens rarely, but it does happen. The worst part of the game.
Ooh, and he gave that promise to the family saying that he's definitely gonna make it.
Tony's heart had a lot of damage.
You don't do this type of conversation in an open setting like this. You invite the family into a counseling room, you explain what happened, but you don't do it out in the open like this because this is just gonna end badly.
You shouldn't let the fact that we had sex get in the way of you taking your shot.
Shouldn't have had sex, period. Dr. Shepard.
Name the common causes of post-op fever.
The 5 W's, bruh.
Can anybody name the common causes of post-op fever?
Atelectasis, UTI.
Wind, water, wound, walking, wonder drugs.
Yeah, she got the 5 W's.
How would you diagnose?
I hope she says CT scan.
Spiral CT.
And not like
BQ
a VT
scan,
scan or something.
provide O2, dose with heparin, and consult for an IVC filter.
No! She just gave all of the options that you have in testing somebody for a pulmonary embolism, as well as treatments that you may give to someone with a pulmonary embolism.
I'd know you anywhere. You're the spitting image of your mother. Welcome to the game.
Welcome to the game. I've never heard a doctor speak like that. Welcome to the game.
From one extreme
You never want to sleep on a stretcher as a resident because it's bad luck. It basically says that you're gonna wind up on a stretcher. You have the on-call rooms, you have couches you could knock out on. So sleeping on a stretcher, that's just bad form.
I should go do this.
You should.
The romance is real.
I'll see you around.
Thought McDreamy would have a little more muscle on him. He kind of is looking a little frail there. Boom, there you have it. My first Grey's Anatomy episode is in the books, and you were here to experience it with me. All in all, I'm pleasantly surprised with this Grey's Anatomy episode because I assume there's gonna be just way more loving and sex, and that's what the whole show is gonna be about. And in reality, it did take a deep dive into how a resident feels and what their work is like, so I thought that was pretty good and it surprised me. Medical accuracy, obviously weak, but I don't think most people watch Grey's Anatomy because they want to become doctors and they want to learn about the human body. I think it's an entertainment show first and foremost, and I think it does a great job at that. The fake McDreamy's back, AKA me. I'm gonna be watching my second episode of Grey's Anatomy alongside you guys. Let's get it started.
Turn up the TV.
A massive train wreck occurred just outside of Seattle minutes ago.
911. You just worked a 30-hour shift.
I don't have any clean underwear.
The Vancouver-bound train was...
That's crazy. They worked a 30-hour shift and they can get paid to go back?
Hello. I seem to be a little bit drunk. I was off duty.
So was I. Anybody else half in the bottle?
No.
I don't get why she would come in to her shift if she's drunk. That's not helpful to anybody. And if she starts performing any kind of medical procedures while under the influence, that's not good for patients, that's not good for her. It's just a subpar solution, so I don't really understand what she's even doing there. She should be making a little love with McDreamy.
Was that a knock?
Yes?
Do we know what it meant?
No.
Am I invisible?
How much romance? I feel like this isn't a medical show anymore, it's just a romance show. Whoa. What is that? That...
Okay, fine. Maybe it's the second one.
That was crazy.
So are you gonna pull this pole out of us anytime soon?
Touch uncomfortable.
I'm sorry. We can't do that until we get a better look at what's going on internally. But I assure you, we will work as quickly as possible.
They're taking this very not seriously and a lot of humor with a pole jammed into two people's bodies. Whoa. That's all I can really say right now. Something that I think needs to be done immediately is to give them some sort of back support so that they don't get fatigued and tired and start slouching. Because if they are to slouch when they get tired, and they obviously will get tired, they can do more internal damage with that pole going through them.
You are drunk. Go get yourself a banana bag IV, put it in your arm, and then find me. Do not speak to any more patients. Do not practice any medicine.
IV drips do not stop hangovers. This is why so many people are opening these IV drip spas, especially in Vegas. I see that happen a lot, and they promise you that it's gonna block or cure your hangover. An IV will hydrate you the same that you can hydrate yourself by drinking some water or drinking some fluids with electrolytes in them. Now that being said, it's gonna be a little bit quicker, but then again, you're also increasing risks because you're opening a hole in your skin to get that IV in. Something to mention about hangovers is that it's not all about dehydration. A hangover is like a catch-all term for all sorts of symptoms: nausea, vomiting, fatigue, dizziness, a dry mouth. Yes, hydration may help some of these things, but it's a complicated process that has a lot of things going on in it. Just giving yourself hydration is not the sole answer.
No, we're fine, honey. Yeah, some redneck tried to outrun the train. Honey, and the train slammed into his ass, and then it rolled.
That hurt?
Oh, no. That dude is toast.
He was doing sutures, it looked like, above her eyebrow. No doctor would perform sutures like that. Keeping your hands elevated like that from a lowered position and doing sutures, you're gonna get fatigued so quickly and your hands are gonna start shaking and you won't be able to do it right. You always need to be above the given situation.
Where you going?
I'm taking your friend for an x-ray.
No offense, little boy, but you look like my oldest son, and he's nothing but trouble.
Yvonne, shut up.
What? I said no offense. I'm just saying, are you sure you're a doctor?
I get that all the time.
What are you doing?
trying to insert my banana bag, which sounds vaguely dirty, but it isn't.
A banana bag is just an IV bag with normal saline, which is fluids with electrolytes in them. There's also some vitamins in there. Generally, this is given to people who are chronic alcoholics because they're usually nutrient depleted. Giving a banana bag to someone who's healthy and had a few drinks, pretty much useless. Just have some water and give it some time.
His legs.
What about them?
They're both left.
Find the man's leg, Yang. Find it now.
Yes, sir.
They got the wrong leg? And why did she say it only then?
These people are still alive?
They're still making small talk.
Poe's tamponading the wound as far as we can see.
When she says that the wound is being tamponaded by the pole, it means that it's exerting pressure and actually preventing them from bleeding. That's why if you ever get stabbed with something, it's never ideal to just pull it out automatically until you have medical care. That object, whatever it is putting pressure to stop the bleeding.
What if we move one of the patients off the pole to get the saw in there? Then we can hold the pole steady in the other one. Move it very slowly and repair the damage as we go.
Who? Which would you move?
With her aortic injuries, her chances of survival are extremely slim no matter what we do.
I don't really buy the realism of this. The aorta is a pulsatile vessel, meaning that every time the heart beats, the aorta moves. So if you have a metal pole that's going through the aorta and has cut it open, there's no way that pole is putting that much pressure that it's preventing her from bleeding out, unless it's like crushing it or compressing it in such a weird way.
So basically, whoever you move doesn't stand a chance.
Why can't they just cut the pole from in between them and then separate them?
So how do
and
you
go?
choose? How do you decide who gets to live?
You're a cute doctor. Cute doctors get to call me by my first name.
Bonnie. Okay, Bonnie.
Oh my dreamy. Can you feel me rubbing your foot?
Could you try to wiggle your toes, Mr. Maynard?
Are they moving?
Yes, they are.
Good. That's good, right?
Yes, it is. Yes, it is.
What about me? Am I moving?
Yes, they are.
Yay, me.
That's probably one of the situations it's okay to lie to a patient.
Is there any chance that we can get out of here sometime this year?
Well, the lab's backed up, and so is radiology, and I can't discharge your friend until I'm certain she doesn't have any internal injuries.
Nowadays, we decide if someone has internal bleeding with an ultrasound called a fast scan.
If I don't find this leg, the chief is going to cut me from this program, and I cannot go back home, Burke. It is too sunny in Los Angeles. It's sunny every day.
I don't understand what she expects. Does she think that the chief is gonna be like, you couldn't find this leg in the rubble, so that's it, you're cut from the program? I don't understand what her thinking is. This supposed to be like a comedic aspect? Is she being sarcastic?
In order to operate on Mr. Maynard, we have to separate you two. In order to do that, we have to move you backwards off the pole.
Can't just pull the pole out of both of us?
Well, if we did that, you would both start bleeding very quickly. Too quickly. Right now, the pole is plugging the wounds. Once removed, the organs will shift. And there's a great deal of damage.
So, if you move me, I'll die?
You're being ridiculous. You're gonna be fine. Do you hear me?
I hear you, but we still have to sign the forms. Unless you want our son to end up with my mom.
How long have you two been together?
Since 3rd grade.
Aw.
We're not lovers. We're best friends.
Oh.
We just wanted our kids to have two parents. So we got a sperm donor.
The same donor. So your baby's your brother and sister?
Oh, how cool is that?
Oh my God. God, who writes this stuff?
Yvonne, that's your phone. Yvonne. Yvonne. Yvonne!
Uh-oh. Yvonne looks like she passed out. Okay, first thing you do during your code blue, chest compressions, chest compression, chest compression, chest compressions. But also, before you call a code blue, you gotta check for a pulse, because code blue means someone's heart has stopped. And just because someone's unconscious, it doesn't mean they're a code blue. So my man needed to go right up there to the carotid, or to the femoral artery, or to the radial artery. This is usually the best place, and feel if there's a pulse. If there's no pulse, yelling for help while doing chest compressions.
She's lost too much blood. She's been bleeding for hours.
There's no blood. She's not bleeding.
She was bleeding internally.
What's interesting about the abdominal cavity is that the back portion, the posterior portion, which we call the retroperitoneal area, it could actually store a lot of blood. So you can be having a very slow leak of blood into that area and not really know that you're bleeding out. The one thing that makes this less likely is that she was talking, she was moving around. Generally, if you're losing blood, you start having symptoms like you feel fatigued, your eyes are closing, you feel like you're gonna faint or pass out, your blood pressure starts dropping, you can even be having some abdominal pain because blood is a natural irritant to the abdominal cavity, so you start feeling pain, and then once we do our exam, we'll note that you have an acute abdomen. We would do an ultrasound or a CAT scan, find the bleeding, and then take you in for what we call an explorative laparotomy, where we literally open up your stomach. By stomach, I mean the skin of your abdomen, look around, check the entire intestines, find where you're bleeding, fix that area, put everything back in, sew you back up, and get you up and moving again. But in this case, she's lost so much blood that she went into cardiac arrest, meaning her heart stopped. Now he's doing the advanced cardiac life support procedure where he's giving epinephrine, he's doing chest compressions, he's helping her breathe with the bag, and hopefully trying to get her pulse back and get her heart beating again.
Oh, no, Yvonne!
Sorry. Time of death, 2:51.
Watch your head. Cool down.
Meredith.
Dr. Gray.
Meredith.
What about her? We cannot just abandon her. We have an obligation.
I'll take care of this. Meredith, come on. There was too much damage. There was never anything we could do. We have to let her go. Time of death, 3:49.
One of the most difficult parts about medicine is triage, knowing who you can help in a given moment and knowing where to use resources when they're very limited. Some of those decisions are heart-wrenching, they're incredibly difficult to make. At times it feels like you're playing God and it's putting you in the most unfair situations, but you have to do your best given what limited resources you have and what limited information you have to make the best possible and fairest decision. I applaud all first responders in these types of mass casualty situations. Growing up in New York City, thinking about 9/11, what that must have been like for people who were working in the local New York City hospitals. It scares me, it blows my mind all at the same time. I've trained in level 1 trauma centers during my medical school time, and just having a few people come in with gunshot wounds or knife wounds or bicycle accidents, those are incredibly stressful situations. You never know what to expect. You always have to be thinking quickly on your feet. So then to imagine what it must be like when hundreds of people or even thousands of people are coming in, wow. So huge thank you to all the people that have ever been involved or may ever be involved in those types of situations in the future. We really respect you and thank you for your service.
Did she suffer?
No. Her injury.
Again, these conversations don't happen in the open. This is not right.
Better get cleaned up. Rounds. 5 minutes.
Today's been
I don't get it. They work 30 hours, then they come in for an emergency, look like they worked for another 12 hours. They've been working for 42, now they're going to morning rounds. Do they ever get time off? Oh man, you guys recommended a doozy here. It presented an interesting situation, unfortunate for the patient that died. Kind of shows you that doctors are sometimes put into really tight spots where they have to use limited information, limited resources, and sometimes let one life go in order to save another, and that's a very, very, very unfair and tight situation that we find ourselves in. That's what we asked for when we decided to go into medicine, and that's why it's a beautiful field, and we get so much admiration put upon us as doctors because we have to make those decisions.
Please welcome my colleague, Dr. Luis Espina, who I actually did residency with, and he was my senior resident. So he taught me everything I knew.
Not everything, but yeah.
You ready? Beep-whoop. You have to do that, by the way.
No.
No, come on. No, you have to do it.
Beep-whoop. Beep-whoop.
Yeah.
You didn't sign the divorce papers. Fine, I get it. End of discussion. What?
I actually don't know anything about their romance, and I know people in the comments are already getting their bows and arrows out to hunt me down.
It's
but
okay.
I don't think they're married. I think he's about to divorce wifey, and she's trying to get him to do that.
Dr. Bailey, Henry Lamont, age 42, is scheduled with Dr. Shepard for a spinal implant to control the pain of his herniated disc. Is allergic to all pain medication.
Really?
Is that?
Porn. Porn. As in porn?
All right. What are we watching?
Karev, go stand in the hall. Miss.
You have to be sensitive to the needs of the patient.
Yeah, but that's overstating it. Have you ever had a patient do that?
No, I don't think the television could get CNN, much less pornography.
Look, we can't have porn in here. This is a hospital.
It's for my pain. My doc says it releases endorphins in the brain. It helps keep my pain at a manageable level.
Not gonna lie, if that helps him over an opioid addiction, I'm with getting him a private room.
I am a firm believer in the what it takes school of medicine, so whatever it takes to make the patient comfortable.
Okay. Pete Willoughby, 25-year-old GSW to the chest. Immediate return of 860 cc's of blood from the chest.
Oh, damn, this hurts.
He's put out more than 200 cc's over the past hour.
They never tell you in movies how much it hurts to get shot.
Push morphine 2 milligrams. Alex, this is my case.
I don't understand in this show when they say a person's lost a liter of blood, that they're hanging out, talking, casually, just chilling.
Hair looked good. His hair looked
His hair looked good.
Looks like you'll be able to go home today, Alice.
But I still have patients to see.
No. No more patients. I'll be back to check on you later.
You should know I'm thinking of leaving Thatcher. I should never have married him. I'll leave him, you leave Adele. Then when our residency's over, we can both get jobs at the same hospital.
Why don't you get her meds ready for discharge, nurse? Thank you.
I mean, I was an old resident, but that's an old resident if that guy's a resident.
I don't know if he's a resident.
Yeah.
I don't understand the storyline. She may be suffering from dementia.
She may be, yeah. I mean, I was old, but that guy makes me look like you.
Yeah.
Well, maybe not quite, but...
That was a long time ago, remember? We had this discussion 21 years ago.
Oh, Lou, it wasn't the rain. I just passed out.
Actually, Mrs. Bradley.
Verna.
Verna, you presented with lateral ST elevations and reciprocal inferior changes consistent with an MI, a heart attack.
So when a patient has a heart attack, as they described it, an ST elevation MI, it's called a STEMI, you gotta get a patient right away into the cath lab, which is where they put a catheter from your arteries, either from down below or from your arm, into your heart, and either open it up with a stent or just evaluate and see if you even need a stent to begin with.
And there's a very strict protocol as to how much time it is from the door to the balloon.
90 minutes.
Yeah. So
90 minutes.
You have to be
door
there.
to balloon.
You have to be on the table and have the cath started.
I've had a twinge in my back for a while. I thought it would go away, but then last night my legs went numb. This morning my back, the pain is just too much.
Miss Chu, we're gonna push on a PCA pump. Give you some morphine, which should help control the pain.
Thank you.
But there's a greater...
That was quick, huh?
It's an awfully comfortable PCA pump.
That's a quick PCA pump. A PCA pump is a pump that's controlled by the patient in order to give them anesthesia. Usually there's an opioid in there. It's programmed so that they can give themselves dosages, but if they're using it too frequently, it times out and doesn't allow them to do it. Now, this is good because when patients have that ability to control their pain relief, they generally use less of it and are more aware of how much they're using. As opposed to when a nurse comes in and doses it, they may overuse.
And in and of itself, being in that much pain can be just a humbling situation. So it returns some measure of control to the patient.
What's going on? I was just about to explain that Anna's MRI has shown that she has a myxopapillary ependymoma. It's a tumor in her spinal canal. But the good news is that we can operate. You have a 95% chance of fully recovering if we get you in this surgery as soon as possible.
You know about that? I don't know about that. And I don't know how he gets those stats right off the top of the dome.
Even waiting another day puts you at risk for permanent paralysis.
Father?
No. No surgery.
Mr. Chu, without surgery, Anna will be paralyzed probably within the next 24 hours.
I hate how they talk about medicine with such certainty, because then it tricks our viewers here from going into the hospital, and when we don't give them direct answers, they're gonna be like, but Derek Shepard, McDreamy, told me that my tumor, if I don't operate in
I
95...
thought you were McDreamy. No?
I know, but this guy.
Look, Mr. Chu, we are taking our daughter home. Anna, you're over 18. You don't need your father's consent.
Cool. This is true.
I'm Meng and my father is the elder. If he says I go home, I go home.
Do I continue to process her discharge?
Yeah, we have to. It's insane, but we have to.
Well, actually, we wouldn't process this as a discharge. We would process this as an AMA, which is leaving against medical advice. Because if we're telling a patient, hey, you may have a disability if you don't get the surgery immediately, and they choose to leave, we have to say that they left against medical advice. Otherwise, they can say, we told them to leave, and then something tragic happens, right?
Right.
It's a legal thing.
You'd be responsible. The problem that you have there is that you want to try to convince the patient and the family with logic and reason, but also some empathy. Because if you just throw the AMA papers in their face and walk out the door, they're definitely going to leave. So sometimes it takes a little bit of honey to catch the bees. So.
I was married for 11 years. Addison is my family. That is 11 Thanksgivings, 11 birthdays, and 11 Christmases. And in one day, I'm supposed to sign a piece of paper and end my family? A person doesn't do that. Not without a little hesitation. I'm entitled to a little uncertainty here. Just a moment to understand the magnitude of what it means to cut somebody out of my life. I'm entitled to at least one moment of painful doubt.
I know nothing about their relationship, but that sounded very logical to me. ¿Y tú?
You might want to have thought about that before you jumped in bed with the intern. So
Scratch my previous piece of advice. I'm going with Dr. Espina, my Hmong or my elder.
You might want to have a little doubt before you run off with the attractive colleague.
Dr. Shepard, still here, I see.
I couldn't leave you. Have you seen the other Dr. Shepard?
I'll tell him you're looking for him.
So,
Ooh, that's his wife?
I guess.
Ooh.
Hey, I got Brenna Bradley's test back. I don't think she had a heart attack.
You ever look at the changes in her EKG? She had something.
Yeah, but her serial enzymes and dobutamine stress echo came back negative. I actually think she's...
Her dobutamine stress echo came back negative while she's having a STEMI. Let's explain what a dobutamine stress echo is. So an echocardiogram is an ultrasound of the heart. You can give a chemical which actually stresses the heart, makes it beat more rapidly, which therefore makes more blood flow occur. Now you can look at the echo and see how the heart responds to see if the walls of the heart are moving appropriately, if blood flow is circulating appropriately within the heart. But now, why are they doing a test like that on someone who's actively having a heart attack based on the EKG? Let's do this as a patient simulation. We have like what, a late 40s female, syncope, chest pain, negative cardiac enzyme with ST elevations with a negative stress echo. What's your diagnosis of this lady?
She's having an MI, so that's...
You would say she's having an MI.
Heck yeah.
You're gonna say she has a left anterior
I'm
descending
saying until
lesion.
proven otherwise, there's something in the left anterior descending. However, there's going to be more drama and I'm going to be wrong.
I have an idea.
What's it?
She did something bad and she has Takotsubo's carditis.
No, she didn't do something bad. Her husband did. And he's
Yeah.
stressing her out and she has Takotsubo's...
That's not a bad guess though.
Broken
right?
heart syndrome. You're really... No, you'd see it on the echo.
No, if it's resolved. It's
No,
a,
it doesn't
it's a stress
resolve.
response.
It doesn't resolve that fast. Ooh, you're in trouble now. They're gonna crack his chest in the elevator.
No,
they're gonna crack his chest.
No, they're not. No, they're not. No.
We're not moving.
Really? You think?
You need a strong hand and a pair of sharp trauma shears right now.
Oh.
That doesn't really happen.
We have generators.
How's the patient? He's not looking so good.
You're a doctor, and that's your explanation of what's happening? Give the rhythm, give the pulse.
Have you ever even heard of the Hmong people? Our religion has got rules that are way old and way set in stone and way spiritual, and you don't mess with them. You don't anger the ancestors. Even if you pierce your tongue and play in a band.
What are the rules exactly?
Good move. When encountering a situation with a patient that culturally it's something that you are not familiar with, Smartest question thus far in the show, what are the rules? By knowing that, you might be able to find a point of compromise to fix a situation.
Apparently, Anna's father believes she's missing something that she needs for surgery.
Missing something? Missing what?
One of her souls. We don't need a social worker. We need a shaman.
There's a shaman.
You definitely did not have a heart attack.
So I can go home.
Not yet. Your EKG shows significant changes. And I'm going to find out why before you leave the hospital.
How to get home? Pete, you're in the hospital. Need to get home. No, I need to get.
So when you lose a lot of blood, you become hypoxic. Your brain's not getting enough blood flow. When your brain doesn't get enough blood flow, it doesn't get enough oxygen. When your brain doesn't get enough oxygen, it starts saying crazy things. Like you're in the middle of an elevator that's stuck, bleeding out from your chest from a gunshot wound, and you say you want to go home.
O'Malley, blood pressure. I've taken it 3 times. And? I can't hear systolic over 50.
So that's quite dangerous. That means he's not getting perfusion to his vital organs, including his liver, brain, and kidneys, which means that those organs are currently dying.
I'll be right back. Wait, where are you going? To get an instrument tray. You guys are gonna have to open up his chest.
Hot damn.
We're just gonna have to get a shaman. Today. In the hospital.
Shaman's unlisted in the yellow pages. Our shaman is 500 miles from here. You are an arrogant man.
No. I'm just a guy with access to a helicopter.
Cool. Let's see how this is gonna happen.
Hey, where are you two going so fast?
Mark is talking George and Alex through heart surgery in the elevator.
Shepard's setting up a shaman healing ritual.
Rock on.
A porn guy.
This show is really medically inaccurate, but it's hilarious.
It is, it's funny.
She has the porn guy.
It's funny.
Wouldn't have residency been much more fun if it was like this? We didn't have to operate in the elevators. We didn't have shaman. We just had patients who had no insurance that we had to battle to get them treatment.
You never shaved your legs.
What?
But be sure you don't cut into the longer heart. How can I be sure of that? You just have to be sure.
On this date, for the past 7 years, you have what looks like a heart attack.
No, I know I've had some scares, but I don't.
Every year on this date.
Is there some significance to this date for you personally?
No, nothing.
What were you doing the first year, the first time you had a cardiac episode?
Oh, I can remember back that far.
We were in the yard. I remember because our neighbor, what was his name?
Ted.
That's right, he died of an aneurysm, I think. And we watched as the funeral home people took him away, and you had your first attack.
And you were close to Ted?
No. Oh,
She shaved her
barely
legs.
knew Ted.
If this is Takotsubo, I'm gonna smack you. I'm telling you right
Come
now.
on, that's impressive.
It's beating a little stronger. Excellent. Keep your finger there. Okay, now what? That's it. That's it?
What's wrong with that picture?
There's open flame in a hospital,
And why is open flame in a hospital, especially in that bed, really dangerous?
but oxygen around there.
Oxygen's a little flammable.
Well, it potentiates the fire, yeah.
You have stress cardiomyopathy.
Cardiomyopathy.
Bravo,
What is- Can you tell me
Dr.
what that
Mike.
is?
I have an offer from Boston General.
You took it to get away. We swore we'd never talk again about what we had together.
This reminds me of The Notebook. You guys ever watched The Notebook? Romantic movie.
I didn't see it.
You didn't see it?
No.
We should watch it. Like a bro night.
Yeah, no.
It takes away his pain. See, the thing is, Henry takes away my pain.
Humans are weird. All of us, myself included.
Well, we're all unique, and again.
Did you just use a synonym for weird?
Yeah.
In a more positive tone?
Yeah.
Usually you're the dark one.
I am. I don't know. I'm in a good mood today, but yeah.
Probably because of the porn.
It must be the porn.
Choose me. Love me. I'll be at Joe's tonight, so if you do decide to sign the papers, meet me there.
Oh. No, you didn't like it? Too narcissistic for your taste? Pick me. I think it's a beautiful day to save lives, don't you agree?
I'm gonna like being married. It's the wedding part that's ridiculous.
Oh, party's over.
You know what's funny? Even though this show was filmed so long ago, this scene of them hanging around and having pagers still rings true. All my residents still carry their beepers around and they get paged and they have to interrupt what they're doing to go respond to an emergency. Now, we're not surgical residents, we're family medicine residents, but equally as important, just on different terms.
You marrying Burke, it's a sign. Sign that people like you and me can do this. Be healthy, be happy.
Did you just steal my line in the show?
They found the fourth climber. Vitals are stabilizing after fluids, but
I thought he was dead.
It was, according to his friends. Did the CT show a bleed?
we haven't done a CT
I
yet.
understood you said there was a head trauma.
Yeah, there's been a little head trauma. Ice axe to the head.
Oh, so you really need probably a neurosurgery consult at this point for having an ice pick stuck in this gentleman's head. Now, as I told you earlier on this channel, if you ever get hit with something and it stays inserted into you, a knife, ice pick, whatever it is, you don't take it out because it's putting pressure on there to prevent you from bleeding out. So if you take that ice pick out, what's gonna happen? The person's gonna bleed, especially from the skull. If you ever needed to get staples placed in your scalp because you cut yourself, you know how much it bleeds. Even the smallest little cut on the scalp bleeds a tremendous amount. It's actually really scary. But it's only because there's a lot of blood supply to that area, not because there's a lot of damage to that area. So just keep that in mind.
My wife came into my hospital and you neglected to tell me?
Doctor-patient confidentiality.
And it's actually a very difficult place to find yourself because if you have one of your colleagues, family members as your patient, you want to share and you feel like you should be able to share, but in reality, you can't. I actually treat a lot of my colleagues, even my attendings when I was a resident, their children. And as a result, the things that their children tell me, I can't share with them. Only when they're brought into the room by the patient or the patient expressed the fact that I can discuss their case with them, do I then incorporate them into the conversation. But in reality, it's two separate people. Just because I know both of you doesn't mean I can freely talk about your care to one another. There's some things we share with our families, some things we don't, and that's a right.
She's unconscious. There are medical decisions to be made. Legally, I have the right to know. I have a right.
She might be having a miscarriage.
What's wrong with me?
I'm going to explain everything to you, I promise. But right now, we need to get you up to the surgical floor.
Surgery? What about my babies?
I think those babies are coming out today.
But I haven't decided. I haven't chosen parents. I need time to decide.
It looked like he was doing an ultrasound of her heart, which is an echocardiogram. I didn't follow the case from the previous story, but it sounds like she's pregnant and she's acting as a surrogate to give the child to one of the two families there. I wonder what can be going on with her heart that they need to take her for an operation. The medical curiosity in me is a peeking.
How's Rena?
I need to get a CT angio, but I'm pretty sure it's a tear in her aorta. Her heart is about to blow.
Whoa. So dissecting aortic aneurysm is when there's an aneurysm within the aorta, which is the largest blood vessel that comes off of the heart and brings blood to the rest of your body. An aneurysm, first of all, is a weakness in the wall where it actually protrudes out. So if you imagine your artery being like a balloon, and then one area of the balloon is very weak, so it creates almost like an outpouching. When that happens, that wall is very susceptible to bursting and rupturing because it doesn't have all the layers that the rest of the artery has. So what can happen is you can have a dissecting aortic aneurysm where it's getting so bad that that weak arterial wall is literally about to burst, and that patient can rightfully bleed out and die because of all the bleeding internally. So you have to go for surgery immediately. I just don't know how this is happening in such a calm situation because it's really a medical emergency or a surgical emergency where you need to go and start the operation.
I didn't page you. Go home, get some sleep.
Yeah, but I'm here already, so.
You're getting married in less than 12 hours.
Well, Burke's getting married too, and he gets to operate.
There's only one Kristen Burke.
There's only one Christina Yang.
I've given you the day off, the whole day. It's a kindness. Take it. It's your wedding day. There'll always be more surgeries. But really, what would you rather be doing? Prepping a patient or prepping for your wedding? Go home.
Those who love our jobs and who are passionate about our jobs, we want to be there. But it's at times we have to pump the brakes and realize that if we want to perform better at work, it's actually ideal to take some time off. This is why one of the biggest problems that people face is that as they make more money, you would think they would become more financially independent, therefore take more time off. But in reality, they just become slaves to their money and to their job. It's really important to not burn out, Because too many people in our society right now are working day in and day out, and there's times we need to do that, and we need to put our foot down. But then there's also times where we need to understand that a break will actually yield better results.
They recovered Lonnie's body?
Not his body. He's alive. So why don't you tell me what really happened up there on the mountain?
So I'm assuming, because I don't know a lot about this case, they're on a mountain, they were trapped, there's frostbite happening. Frostbite generally happens on areas that have less circulation, and areas that not only have less circulation, but are ones that your body will decrease blood flow to in order to conserve warmth. So for example, if you ever see your hands get blue when you're really cold, that's your body naturally protecting yourself from losing heat. What it does is redirects the blood back to your core so that you stay warm, your vital organs stay well perfused with blood flow, and you don't need a lot of blood flow to keep your hands alive. So if they look blue, that's what's happening. There's also a condition called Raynaud's phenomenon. You have an ultra-sensitive reaction to cold. So just being in a cold location for a short period of time will make your hands turn blue. A simple test for that is to put your hand in cold water, and I'm not recommending you do this, but you could put your hand in cold water and take it right out. If your hand turns blue really quickly, you have what's known as Raynaud's.
It's an accident.
I feel like it's not McDreamy's place to make the decision on whether or not it was an accident. In this scenario, if I have people talking about self-harm or, I don't know what you would call this, like an assault type situation, even if you think it may be on accident or self-defense, you have to get the authorities involved. I think that's the ideal situation. Maybe not right in this moment because no one's escaping here. They all look really injured, but at some point, you have to get the authorities involved.
So should I be worried or something?
Should you be worried that I met a woman? No. Should you be worried that for me flirting with that woman was a highlight of my week? Yeah, you should be worried or something.
What kind of threat was that? That's manipulative, McDreamy. Don't do that.
I just checked. Chief Resident hasn't been posted yet.
No, I wasn't looking for Chief President.
Yeah, you were.
Yeah, okay, I was.
For those of you who don't know, chief resident is a really important position, even more important when you're a surgical resident. I'll give you an example. In family medicine, the senior attendings all sit together on a committee and nominate who's gonna be the chief resident. Generally, the way it works is the chief resident in their last year of residency takes on the additional role of doing all the scheduling, all the organizing of the rest of the junior residents. In internal medicine, they may actually stay on for a fourth additional year. To do that, consult on difficult cases, work in specialties that they feel they need more help in, or they use it as an opportunity to showcase themselves for fellowship positions that they may have not gotten, or to make themselves more competitive in the upcoming match. Very prestigious, but very difficult to be successful at.
Housing a human for 9 long months is all that I can think about. The thoughts are invading the surgeries that I love, and it's hormonal. It's and horrible. But it is happening. To me.
You want to have a baby.
Did one resident just ask another resident to impregnate her because she wants a baby? I hope I'm missing something and they're actually in a long-term relationship and that was their way of talking about it.
Pressure's dropped to 60. She's breathing it down. Addison, how much longer?
Rupturing the membrane now. I just need 2 minutes to get these babies out.
Make it 1. She's flatlined. Steven, start compressions.
Yay, they're starting chest compressions before shocking the patient first. I'm sorry, I'm so excited that a patient's flatlining, but I'm just happy that he said start chest compressions before whipping out the machine to shock.
Clamp. Second baby's out. Okay, go.
Oh my God, but look at those horrible chest compressions happening in the background. Oh my God, the doctor's there going like this. Hold on. That is not 100 beats per minute. That's not 2 inches deep. Chest compressions, chest compressions, chest compressions. I feel like I'm yelling at every video.
Is he gonna wake up?
Do you want him to?
What?
The axe in his head was put there deliberately. I just want to give you 3 guys another opportunity to tell me the truth.
You're not a cop.
Oh. What's going on?
She started cramping and then she got really diaphoretic.
Alert OB to a possible DNC due to an incomplete miscarriage.
So a DNC is a dilation and curettage, but it's basically a medical procedure to get the uterine contents out. That can be really important if there is bleeding going on. You're trying to figure out where the source of bleeding is coming from. This is something you need to do very urgently. I understand why, because this patient is bleeding out, diaphoretic, cramping. Cramping means that there's bleeding probably happening in the uterine cavity. We need to diagnose and treat it simultaneously with a DNC.
She went into early DIC. I gave her blood, platelets, FFP. Pregnancy at 52 is dangerous. I tried everything I couldn't save.
Oh, wow.
Oh.
Oh, the babies.
Oh. I thought. For a second, I thought I'd lost you.
I thought he lost her too, because DIC can be a very deadly and quickly deadly condition. It stands for disseminated intravascular coagulation. It's basically when inside your blood, you use up all the clotting factors and you start clotting. So two things happen. The more platelets you have, the more clotting that happens, but then you also use up all your platelets so that you can bleed from other areas. Very unique situation. There's very specific protocols we have to follow in order to make sure these patients, A, don't bleed out, and B, don't form clots in areas where they can be life-threatening, brain, heart, lungs, etc. I think that might have been the best explanation of DIC I've ever given in my life.
He's a much better man than I thought. He'll get over his initial judgments, and he'll sit with you.
Is it him?
And he'll make you drink your water.
He's the Papa Bear. I mean, sad that he lost a child. God, all right, I gotta really adjust my emotions here.
Because I'm your best friend. And because I love you. I also have to say that I'm in love with you.
I officially want to check what they're pumping into the air conditioning units in Seattle Grace's, whatever the name of this hospital is. I don't know if they're pumping pheromones in there, angel cupid arrows. Everyone's in love with everybody. Everyone wants to cheat on everybody. People want to get married. They don't want to get married. They want to have babies. What? This is the most dysfunctional group of humans I've ever seen.
I want you to give me a reason to stay.
Even the patients are falling in love with the doctors. I can't even, I lost count of how many love triangles and circles and squares. I feel like in order to understand their relationships fully, I gotta bring out the Pythagorean theorem on this one. I mean, for God's sakes, Grey's Anatomy, keep it together.
You don't want me.
Maybe I do.
No, you don't. You want Ava.
She's not Ava anymore.
I know why this is one of the top fan favorite episodes. Because everyone's in love with is it something about weddings? Or is this every Grey's Anatomy episode? For some reason, every episode I've watched before, there's a lot of medical stuff, a little bit of romance. This is everyone is on top of everybody all the time.
I'm up there waiting for you to come down the aisle. And I know you don't want to come. I know you don't want to come, but that you'll come anyway because you love me. And if I loved you, not the woman that I'm trying to make you be, not the woman that I hope.
What is happening right now? Did they need to make everything more dramatic than it needs to be? You decide to get married, you love each other, but the person's hesitant. So now you're being worried that they're hesitant and your love contradicts their love. We should just change the name of this episode to Dr. Mike Loses His Mind Over Grey's Anatomy instead of React. There's no reacting, I'm just losing my mind at this point. I feel like you guys missed out my latest medical memes review and my hospital vlog, so if you did click one of those bad boys, and as always, stay happy and healthy.